So when you see a new patient and you're evaluating them for which type of filler to use, how do you assess them and how do you make those recommendations?
Well, the first thing I do is I get a history. Have they had fillers before? If someone has never had a filler, but they know and they don't know anything about it, I would say most of the time I'm just educating them, telling them what fillers are, why we do them, the safety profile of fillers. And a lot of times, if I have someone that's never done a filler, it's not that uncommon for me to say, especially if I detect any sense of anxiety or nervousness on their part, I'll often recommend that we start with an HA filler, something like Juvederm, Restylane, Voluma, because for a lot of people, it's important for them to know that if they don't like it, it's reversible. There's an antidote.
Right, I agree, and that is a nice feature to those types of fillers. But again, they're short acting, and I think anyone who has experience with fillers will find that they may start with that, but they transition because they get needle fatigue, or they, cost-wise, it gets expensive to come back every 6 to 12 months to have your filler. So,
and it's interesting. I'll sometimes when I'm with a new patient, I'll go through the pros and cons. And I'll talk about using Juvederm, and that you can, if they don't like it, we can dissolve it and get rid of it and start over again. And then I'll also talk about a filler like Bellafill. And I'll also say in many cases, if you've never done a filler, it's okay to do something like Juvederm. Put your toe in the pool, see if you like it. If you do, when it comes time to replace it, you can always transition to Bellafill.
Right.
But it's interesting, Greer, sometimes when I do that, they make the decision to go right to Bellafill from the get-go.
I find that as well, and I think part of that is just the patient education. They have to kind of know, where they're going, what direction, how much it's going to cost, and if giving them all that information helps them make the decision.
Very good.